Since this unfolded, we've wanted to know how Meade and Umfenauer were able to allegedly coordinate this and escape. Our Jude Binkley spoke with a prison security expert about how something like this could have been planned. Jude, we know that Meade was in IMSI prior to this.
That's right, Morgan. And you just said a really key part of this planned, because police and prosecutors are saying this was a pre-planned attack to get Meade out of prison. And even with Meade in the highest level of security at the state prison, there are possible ways this could have been coordinated and communicated.
That is the nightmare of transporting people outside the walls, which is why, as much as possible, we try to provide medical care inside the facilities.
Donald Leach is a prison securities consultant and former deputy director of a jail in Kentucky who's had to deal with attempted escapes in the past.
This is not an uncommon situation.
Including an escape where an inmate at the jail Leach was working at injured himself and escaped after being taken to a hospital's mental health care facility.
He kicked out the windows at there and got out and escaped, and he was out for about I think 22 years before he was recaptured.
Leach says there are a couple different ways the St. Al's escape attempt could have been coordinated, possibly through the prison's telephone systems, but there are a number of other ways he's seen inmates try to plan an escape.
You have illegal contraband cell phones get into facility. That could be used to help facilitate something at this level. You could use a letter. They could write in letters, and they use code in letters. All of these methodologies of communicating, you don't have the resources as a correctional administrator to monitor every word, every conversation that's going on in the agency.
IDOC had 3 officers escorting Meade out of St. Al's, which Leach says is more than you would normally see during a medical transport.
I'm sure that being a member of a gang, the gang rotates in and out of the systems all the time, so there's always some level of communication going on. But whether or not they had any active information about an escape attempt, or whether or not they were acting on the fact that this individual made a serious self-harm attempt, they required they transport him out. The fact that they put the 3 officers with him would indicate to me that they took the threat seriously.
And Leach says anytime you transport someone out of prison, there is a risk. And Morgan, another question that kind of came up was around the time this transport took place, which was 9 at night. Leach says the jail he worked at would try to transport inmates during working hours. But of course, that changes when there are serious medical needs and urgent medical needs.
Right. And according to police, Meade injured himself to then get to the hospital. All right, Jude Binkley, thank you.